Sure. So I'm Animesh Tandon. I go by Aashoo. I'm a pediatric cardiologist at Cleveland Clinic Children's. And my work is really related to artificial intelligence and wearable biosensors for kids and adults with congenital heart disease. And I'm also an advisor for the Center for Health Tech and Innovation here at the AHA. It's really interesting. There are a number of high-risk times where we think that new technologies would really help us predict adverse events, understand what physiologic changes are occurring before and after interventions, and these are all parts of the research that I'm doing. And I think the American Heart Association, CHTI, has been really great in bringing a lot of these leading companies and mixing with leading physicians and try to build that bridge. I do think that children are an underrepresented minority, and just like for drug development and therapeutic orphanhood in drug development, I think children are being left behind for artificial intelligence, wearable sensors, mobile technologies, digital health, and so one of my roles on the CHTI is to put in a plug for kids whenever I can. Yeah, so I think the idea about serving children and adults with congenital heart disease as well, of which there are actually more now than there are kids with congenital heart disease, is that think early, right? Come find one of us and say, hey, I have this cool technology, how might it help kids? Or how might it help adults with congenital heart disease? Because if you're 5 years down the road and you've made design choices that preclude being able to be using for kids, or regulatory decisions or whatever, then maybe it's too late, right? But instead, through CHTI or through your local pediatric cardiologist, approaching us and saying, hey, I have this technology, who might it help in the pediatric or congenital population? I think that way we can help, just like you get medical advisors from the adult side, get medical advisors for pediatrics and say, hey, this is how our technology, we can help guide you in that. Even in the adult side, kind of understanding user experience, wearability, whatever you want to call that, is not really, every company has its own internal test, but there are no validated surveys or measures, so we're actually trying to make that for children, for parents of infants, for adolescents, adults, etc. And as with any good company goes to the users and says, hey, how do you like this? But there needs to be a science behind that. That's one of the things that we're working on at Cleveland Clinic Children's and Case Western. We're going to be testing that in the next year or so. Yeah, we also take care of kids with hyperlipidemia. I personally don't, but there are preventive cardiologists in pediatrics too, which is obviously a growing part of our practice. And we are still learning how we need to best take care of those patients because adult cardiology has like a 30-year head start on us in that science. I think what the key thing to think about there is there are clearly technologies that would be beneficial, but there's also, as Dr. Alberts spent a good chunk of yesterday's address talking about, structural changes that need to happen in society. So, when we're thinking about maternal health and fetal development and then how that interacts with congenital heart disease or lipid metabolism when you're an adolescent, right? There are a number of structural changes that need to be made to make those things happen. In terms of the technology side, we need to make it ubiquitous, we need to make it cheap, we need to make it easy to use, and we need to make it actionable. And I think that last part is, all of that falls on us, right? Falls on us as companies, as inventors and innovators and physicians to put the whole panoply together, right? And say, how are we going to put all of the steps to make this something that actually gives us useful information, us as a human and us as a physician? Yeah, the AHA has a key role in that, right? I think the advocacy for structural change is clearly one of the roles that the AHA should play and is playing at the moment. But I think also the CHTI does that work, right? It brings together the people who understand the clinical problem and brings together people who have the technical expertise and try to solve that thing. Solve how we make those two areas fit together. Beyond that, though, I think just like some of the panels have talked about diversity and inclusion, some of the panels have talked about real world implementation, right? We need to continue to broaden the scope of what CHTI covers so that we are really thinking end to end, right? Like technology development to real world implementation, interpretation, and action.